Important Nursing MCQ Series, Subject Community Health Nursing, Part 5. The first question is: measles vaccine should be used within the following time after reconstitution. Option A 6 hours, Option B 3 hours, Option C 10 hours, Option D 8 hours. The right answer is Option A 6. According to the World Health Organization, the measles vaccine should be used within 6 hours after reconstitution. Next question. Midday meal program was started in Option A 1995, Option B 1971, Option C 1975, Option D 1978. The right answer is Option A 1995. The midday meal scheme is a school meal program in India designed to better the nutritional standing of school-age children nationwide. Midday meal scheme was started in India on 15th August 1995 under the name of National Program of Nutritional Support to Primary Education. In October 2007, it was renamed as National Program of Midday Meal in School, which is popularly known as Midday Meal Scheme. Next question. The ovum is released from the ovary on which day of menstrual cycle? Option A 12, Option B 22, Option C 6, Option D 14. The right answer is Option D 14. Ovulation is a process in which a mature ovum is released from the ovary. It is usually occurred around 14 of 28-day menstrual cycle. The ovum then travels down the fallopian tube to the uterus. It is fertilized by a sperm. It will implant in the lining of the uterus and begin to develop into a baby. If it is not fertilized, it will be shed during menstruation. Next question. The National Water Supply and Sanitation Program was started in Option A 1953, Option B 1954, Option C 1964, Option D 1956. The right answer is Option B 1954. The National Water Supply and Sanitation Program was launched in 1954 by the Government of India as part of Health Plan to assist the states to provide adequate water supply and sanitation facilities in the country. Next question. Causative organism of syphilis is Option A Neisseria gonorrhea, Option B chlamydia, Option C Haemophilus tickeri, Option D Treponema pallidum. The right answer is Option D Treponema pallidum. The cause of syphilis is a bacterium called Treponema pallidum. The most common way syphilis spreads through contact with an infected person's sore during vaginal, oral or anal sex. The bacteria enter the body through minor cuts or scrapes in the skin or in the moist inner lining of some body parts. Next question. Incubation period of hepatitis B is Option A 3 to 6 days, Option B 6 to 20 days, Option C 20 to 30 days, Option D 45 to 180 days. The right answer is Option D 45 to 180 days. If symptoms occur, they begin at an average of 90 days, ranges between 60 to 150 days after exposure to hepatitis B virus 6 or 12. Next question. Hydrophobia means Option A fear of food, Option B fear of water, Option C fear of cold, Option D fear of death. The right answer is Option B fear of water. Hydrophobia is a late-stage symptom of rabies that cause a person to have an irrational fear of water. Fear of food is known as sebophobia. Fear of cold is known as frissophobia. Fear of death is known as thanatophobia. Next question. 90% of poliovirus infected cases have Option A high fever, Option B chest pain, Option C paralysis, Option D no symptoms. The right answer is Option D no symptoms. 90% of poliovirus infected cases are asymptomatic, meaning they do not exhibit any noticeable symptoms. Next question. Ascariasis is the infection of option A, urinary system, option B, circulatory system, option C, respiratory system, option D, gastrointestinal system. The right answer is option D, gastrointestinal system. Ascariasis is a disease caused by the parasitic roundworm Ascariasis lumbricoides. Infection have no symptoms in more than 85% of cases, especially if the number of worms is small. Symptoms increase with the number of worms present and may include shortness of breath and fever in the beginning of the disease. Next question. Characteristic feature of tetanus is option A, anorexia, option B, oral thrush, option C, lockjaw, option D, skin rashes. The right answer is option C, lockjaw. Tetanus is a serious disease of the nervous system caused by a toxin-producing bacterium. The disease causes muscle contraction, particularly of jaw and neck muscles. Tetanus is commonly known as lockjaw. Severe complication of tetanus can be life-threatening. Next question. Enteric fever is also known as option A, malaria, option B, polio, option C, typhoid, option D, dengue fever. The right answer is option C, typhoid fever. Typhoid fever, also called enteric fever, is caused by Salmonella bacteria. Next question. Sleeping sickness is transmitted by option A, tsetse fly, option B, sand fly, option C, mosquito, option D, rabbit. The right answer is option A, tsetse fly. Sleeping sickness, also known as African trypanosomiasis, is caused by the parasitic flagellate Trypanosoma brucei, which is injected into the body by the tsetse fly. Next question. DOTS is given to treat option A, AIDS, option B, TB, option C, polio, option D, measles. The right answer is option B, TB. DOTS stands for Directly Observed Treatment Shortcut. DOTS is a strategy used to reduce the number of tuberculosis cases. Next question. Measles is a disease of mainly option A, adult, option B, old age, option C, childhood, option D, all of the above. The right answer is option C, childhood. Measles is a highly contagious vaccine-preventable childhood infectious disease caused by measles virus. Other names include morbilli, rubella, red measles and English measles. Next question. Cholera is a option A, fungal infection, option B, bacterial infection, option C, viral infection, option D, protozoal infection. The right answer is option B, bacterial infection. Cholera is a disease caused bacteria Vibrio cholerae is contaminated shellfish or water. It can cause mild or severe watery diarrhea that can quickly lead to life-threatening dehydration. Next question. Yellow fever is a option A, fungal infection, option B, bacterial infection, option C, viral infection, option D, protozoal infection. The right answer is option C, viral infection. Yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes. The yellow in the name refers to the jaundice that affects some patients. Next question. Immunity means option A, treatment of disease, option B, prevention of disease, option C, disease resistance capacity, option D, none of this. The right answer is option C, disease resistance capacity. Immunity is the state of being insusceptible or resistant to a noxious agent or process, especially a pathogen or infectious disease. Immunity may occur naturally or be produced by prior exposure or immunization. Next question. Mode of transmission of cholera is option A, contaminated water, option B, contaminated hand, option C, contaminated food, option D, all of this. The right answer is option D, all of these. Cholera is a bacterial disease that spreads through the consumption of food or water contaminated with the feces of an infected person. It can also be contracted by eating raw shellfish that contain the bacteria. Next question. Malaria mainly affects option A, spleen, option B, kidney, option C, liver, option D, intestine. The right answer is option A, spleen. Malaria primarily affects the spleen because the spleen is responsible for filtering the blood and removing infected red blood cells. During malaria infection, the parasite infects and destroys red blood cells, leading to an enlarged and overworked spleen, as it attempts to clear these infected cells from the bloodstream. Next question. Causative organism of plague is option A, Yersinia pestis, option B, Coxiella burnet, option C, Leishmania, option C, none of them. The right answer is option A, Yersinia pestis. The causative organism of plague is Yersinia pestis. It is a gram-negative rod-shaped bacteria that is responsible for causing plague, which is a serious and potential deadly infectious disease.